Welcome everyone. This is Margaret Ahman, Communications Coordinator with the California WIC Association. We're so glad you've joined us today for another one of our WIC Works webinars. Today we're going to be learning about saving babies through milk bank donor drives in WIC clinics and other ways that we can promote the donation of human milk to benefit infants at risk. We have some great presenters with us today, some very skilled professionals, and I'm just going to go through a few introductory slides to get us going. We also have our Executive Director, Lori True, here with us this morning. It's morning where we are anyway. We know that people from all over the country are attending, so we're really glad to have you with us. Our objectives today are to describe why we need banked human milk and why that need is increasing, to look at ways that organizations can recruit donors of banked human milk and how that's similar or different to things like blood banks, and then look at the reasons why community human milk drives are effective ways to recruit donors, and we'll see some real-life examples of how that's been happening here in the Sacramento area. I just wanted to give you a few best practices for listening to our webinar. We've had some technical difficulties in the past if some of you have participated, and we're trying to troubleshoot those, and hopefully we won't run into any today. But if you are listening on your computer speakers, please close any unused programs that might be streaming data. So that includes your email or music. And then use a high-speed wired connection if you can, but wireless can also work. And a USB headset is recommended. If you're connected by phone, hopefully you figured out that you were given a phone number and access code, and once you connected, you got a PIN number. If you have any other wireless devices around, including your smartphone, if you could keep that at a distance so that it's not streaming data and interfering with the live webinar stream. And then also be sure to not put your line on hold. It tends to mess things up, but you are on, everybody is muted who's listening in, so that shouldn't be a problem, but just don't press the hold button on your phone. Great. We will be taking questions. We welcome your questions, and we will be screening them and then answering them at the end by our presenters. And we'll type those questions into your question box, and we'll be able to see them and respond. And just a reminder that the recording, we are recording this webinar, and the recording and the presenter's slides files will be on our website within a few days after the webinar. So you're welcome to share those and refer back to those. For all of you who are registered dietitians and expecting to get a continuing professional education unit for this webinar, just remember that you must have registered in advance, and if you're listening in as a group, you need to send some sort of documentation to our assistant, Megan Sadler, at calwic.org, so that we have some sort of a record that's required of us as a CPEU provider. And then you'll get a certificate via email if you attend for the whole time. So we're glad to have you with us. And for those of you new to the California WIC Association, that we call CWA, we're a nonprofit member organization of local California WIC agency directors, but a whole host of other supporters and advocates for the special supplemental nutrition program for women, infants, and children, fondly known as WIC. We are celebrating our 40th anniversary of the WIC program, and doing so by continuing to provide training and staff development, public education and advocacy, research and policy analysis, and you can find out more about us and become a member if you like at our website, which is calwic.org. So at this point, I'm going to introduce our first speaker, who is Pauline Sakamoto. She's the Executive Director at the Mother's Milk Bank in San Jose. She's a registered nurse and has a master's in community health nursing, and she's also trained as a lactation specialist. She also has been, well, the Mother's Milk Bank has been around for also 40 years, like the WIC program. So we're both excited to be celebrating big anniversaries this year. And Pauline's going to tell us more about milk banks and why we need milk donated. So take it away, Pauline. Be sure to unmute your phone and show us your screen so we can see and hear you. You see your slides? Click on the microphone button again so we can hear you. Pauline, you're still muted, so on your control panel, click on the mute button to unmute yourself. It should be green. Or if you clicked on your phone, we're still waiting to hear you, Pauline. There should be a green microphone button at the top of your control panel on the left. Still can't hear you, Pauline. Pauline, we're having trouble hearing you, so I need you to put the mute button.
Am I on now?
Yes, excellent. Thank you.
Okay, thank you. Sorry about that. I'm just not used to this kind of stuff.
We're happy to have you with us, so go ahead.
Thank you. I'm part of the Human Milk Banking Association of North America, and I think there's a big group out there that's listening to this. But it gives me great pleasure to give some information about what we do and something new that we've just started in the last couple of years, which is milk drives. And just to give a brief background about who we are, the Mother's Milk Bank is based basically in San Jose, and for 40 years we have been a 501c3 nonprofit supplying donor milk mostly to the western coast. And our mission basically is to, provide, to make sure that there's an enhanced availability of milk for all babies. And we're talking about not only donor milk, but also breastfeeding for babies and moms as well. So our focus is to make sure that moms are successful at breastfeeding. And as a member of the Human Milk Banking Association of North America, or commonly known as HMBANA, our mission fits right into their mission as well. And we are also all nonprofits as well. And in that respect, because our mission is to provide donor milk for babies, we really, our true form is that we want that moms are successful at breastfeeding, not at, and that if they're not successful at breastfeeding, then we supply donor milk to them. We consider donor milk as a bridge, so that if the mom is having real significant problems in getting her breastfeeding started, that donor milk then could possibly be a bridge to make sure that she completes and actually becomes successful at breastfeeding. And so our mantra, if you will, with HMBANA is that mom's milk is the most important, is for the baby to get mom's milk first. And in the event that a baby cannot get his or her mother's milk, then donor milk should be considered. So what are we different about it is that we just want to make sure that every infant has an ample amount of breast milk or donor milk to get the best possible start in life. I'm having problems now with my slides. Next slide. Okay, and so these are pictures of babies who we supply donor milk to. These pictures are mostly about NICU babies, but we also provide milk to the babies that may have graduated from the NICU and are in the home and may have to go home with donor milk as well. And this particular picture on the screen right now came from our Facebook about a mom who in our area, breast cancer for young moms is pretty epidemic, and we were able to provide donor milk while she was in the middle of her breast cancer therapy. Let's see, where's the next slide, please? So the Mother's Milk Bank, we've been providing milk for 40 years. We have grown tremendously in our distribution. We are always, as of the last couple of years, we are always in need of donor milk. It just seems like the demand is so much higher than what we can provide and what we could collect, so to speak. And so we're always looking for innovative ways to find that milk. It is not unusual that we hear, in a lactation course or doctors groups, I go out and do presentations and we hear that they've never heard of the milk bank. So this is a great opportunity for us to do milk drives, to get the community, people that are involved with lactation, to be able to provide an opportunity to get them together and explain what our program is. And I think that we really need to focus the message to say that it's the babies in your neighborhood that need donor milk in your local hospitals and communities. Sometimes there's always a vision that when they ship milk to San Jose, that somewhere that milk mysteriously goes to San Jose and not to where that mom is living. And in fact, we can show you, that we have hospitals that use our milk throughout North America. So it's really important that we get get that message out. Now, this is just San Jose's milk bank, the growth, and this, all I want to say about this chart is from 2000, and actually beyond that, to 2013, there has been tremendous demand for milk, and the majority of the demand is for the NICUs. We are beginning to see a lot of the hospitals in California start utilizing donor milk in their pediatric units and in the step-up nurseries. And also now we're beginning to see some of the medical centers use the milk as again, as a bridge or a supplementation for mom's milk in the event that her milk is failing to come in on time to nourish her infant. So that's a great feeling, and again, that means more milk that needs to go out. And I think for Humana, I can tell you that as a member of Humana, last year we sent out 3.1 million ounces of milk, and 75% of that distribution went to NICUs or hospital units. So you could see that the growth is dramatic nationwide, and that other studies will say that we're only servicing about 33% of the NICUs in the U.S., which means we've got 70% of the NICUs still in line, waiting, if you will, waiting either to start up getting donor milk or getting their infrastructure developed to get donor milk. So our impact in California is that we've distributed over 500,000 ounces last year, and we service about 104 hospitals throughout the western U.S. And we've had about 86 outpatient clients. Now, these individuals are very interesting because typically they're graduates of the hospitals and ICUs, or they're older children for whatever reason, whether it's allergies or anomalies that they're on milk. And although I have 680 volunteer donors in 2013, we actually had more volunteer donors than that. And it takes a lot, and most donors today, I don't want them to feel bad if they can only give 100 ounces, but we have donors that give a variety amount of milk, so it just depends on, what their situation is. The clinical uses, again, it's preterm infants, and then we have the other children. Here's a list of them. They're failing to thrive, immune deficiencies, malabsorption, short gut syndrome. And we do have very, very small numbers of adult cancer patients who are getting human milk. We also have nationally a number of children that are the spinal muscular atrophy children who typically, once they're diagnosed with this, have a really poor outcome by the age of 2 or 3, and we see them actually doing quite well, slowing down the symptoms of loss of fine and gross motor skills. That they actually are, we have them on human milk, some of them in California, they're 6 and 7 years old and doing well. And again, of course, emergency situations. I anticipate when there's a big event that all the milk banks are going to be called to action, to supply donor milk to some of the hospitals and shelters that would be helping moms with lactation. So a milk drive, what we describe it as a one-day event where, and you'll see this with Jennifer's presentation, where the community groups that are involved with lactation, with moms and babies, the WIC, come together to bring attention to the benefits of breastfeeding and the incredible value of donor milk. And the pictures that you see on this slide are 2 NICU nurses in the desert area of Southern California, and a couple whose baby was the first to receive donor milk at their hospital. And it was a really wonderful opportunity for potential donors and to speak to this young couple, and they shared pictures of their babies and whatnot. And I just wanted to show you the creativity that some of the NICU nurses have in reminding people about our program. And I think the best value of a milk drive is it gives media attention to organizations and mothers who support lactation and are breastfeeding. We want to make sure that breastfeeding becomes the cultural norm in this country to feed infants. And if breastfeeding is not a possibility for the mom or baby dyad, that there's donor milk available. And it also gives opportunities for mothers to meet and support each other. And in the Silicon Valley area, we know that most of our young moms are very mobile. They don't have family members close to them. So it gives them an opportunity to find that group of like-minded women who are doing their very best to feed their infants and to share ideas and comments. And it's really a lot of fun for me to watch that happen. And also it gives highlights to the local resources for breastfeeding and donor milk donation sites. We also, at almost all of the milk drives that we've had, we've been very blessed to have hospital support in providing a place for them to do for us to do the milk drive. So how do we work with WIC and others who promote milk drives? Well, this is what we've done in the past. We have an exceptional group at the milk bank who are very willing and able to get media attention for the events. And we will work with the local folks that are putting the milk bank together. We'll work with them to get the media attention for it. We also will try to provide a staff person from the milk bank to be on site to answer any donor enrollment questions, accept the donations, and to provide direction. If they need to get their blood tests done, we can provide the forms and whatnot. And then we also like, because the media will be at the milk drive, we try to arrange to have current or previous donors come by to the milk drive and either come and bring their milk and have their picture taken with the media to show, you know, what really wonderful people they are about providing donor milk to babies that really truly need it. And also to recipient families. If we have a recipient family in the local area, we try to arrange that they come and talk to the donors and to the community about how much it meant to them to have donor milk. So to support milk drives, we need to find a location and a time to hold the milk drive, and we work with the local and community groups to do that. We help with organize to support the local support for the breastfeeding and milk donations. We'll get the milk donors involved and try to make sure that we get the organizations some kind of poster, if you will, or card or something to give out to individuals that we're going to have the milk drive. We try to organize to have local breastfeeding professionals to volunteer at the event, and we want to make sure that everybody has a good time. We always need help. We always need help in finding donors, and you may not necessarily need a milk drive. We're always looking for those lactation folks that have our brochures and have our DVDs, and just to remind themselves when they have a mom that comes in and says, I've got a full freezer, I don't know if my baby can take it, or if they're a mom who just lost her baby and she has a tremendous amount of milk in her freezer, that there's a place for us, for them to give the milk so that we could supply it to other babies. So the success for us is that we just need super moms who are willing to help infants survive, and most likely the basic tenet is if they can donate blood, they're pretty much eligible to donate milk. And if there's a mom out there that whose baby needs milk, certainly, you know, they are required to give us a doctor's prescription, and we'll try to work with them. I think basically the future is in our hands. We've got a lot of work to do ahead of us to change the cultural norm in this country for breastfeeding to be the #1 choice to feed infants, and if that's not going to happen for medical reasons or physical reasons, then donor milk is the next best. And again, we're celebrating our 40th anniversary with WIC, so congratulations. And I just, here's a picture of one of our babes that we were able to supply milk to, and we had a successful milk drive in 2012 and 2013, and I give it to Jennifer now to give her slides.
All right, thanks, Pauline. We'll move to Jennifer shortly, but first, Lori had a question for you.
Hi,
Yeah.
Pauline.
Hi, Lori.
Could you just back up a little bit for me, actually, and for some of the other newbies on the call, and just basically go over the mechanics and the logistics of donating human milk? What does the mom who's donating have to do to qualify to donate? How is the milk handled as it's transported to your facility? And what happens to it after that to treat it or process it before it's shared with other mothers?
Sure, Lori. So our milk processing, if you will, and screening is very standard with all Humana milk banks throughout the U.S. And so it usually starts with just a very short, brief 3 to 5 minute phone call on a toll-free number to us to just get the name, address, phone number, and some basic information about the mom. Then we either email or mail them our packet, our donor packet, that are, again, questions about their medical history and their baby's history. And we also send with that packet as consent forms that they need to sign so we could utilize their milk, and they're accepting to the fact that we'll take the milk. And also to alert their physicians, their pediatrician and OB, that she's interested in donating milk. And once we get all that, then there's a small blood test, which is free to the donor, and typically we find a lab very close, within 5 minutes from their home, and they just go in with our lab slip, go in and get it done, and we get the results in 48 hours. And typically, without milk drives, we will ship a cooler to the mom's home. We still do that. And once they're screened, just whenever the mom has the need to empty out her freezer, we just ship a cooler to her. What we like about the milk drives is it brings to the public the idea that, you can bring your milk to the milk drive, but guess what? We could make it very easy to do for the mom in the home anywhere in California or the western U.S. It's very easy to do, and it's quick.
Great. And then what happens to the milk once you get it?
Well, what we do is we do a processing system. So we'll bacteria test the milk, and then we'll heat treat the milk. There's a specific processing system called Holder pasteurization, and it's a heat treatment process, and then we bacteria test the milk again, and then it's frozen. And our standard is that any milk that goes out of a milk bank must have less than one colony of bacteria, milk, which basically is almost sterile. But all the components of the milk, the nutritional composition is still intact, and a lot of the immunity is also intact in the milk as well. And then once the milk is processed, tamper-proofed, and barcoded, then whenever a recipient family calls us or a hospital calls for milk, then we will ship the milk out overnight express because it is frozen. Does that help you?
The moms ship the milk in from their freezers using dry ice in a cooler via FedEx?
Right.
Great.
But we don't want that until we screen the mom.
Yeah. Great. Well, thanks, Pauline. I just wanted to make sure the audience understands sort of the logistics and some of the hygiene issues that you cover. Thanks.
Right.
Great. Thank you, Pauline. We had some good questions come in. Some of them have already been answered by you. Thank you. And we invite people to continue having questions come in that we'll address at the end of the webinar. But first, I'd like to introduce Jennifer Pettis. She's a regional breastfeeding liaison at the Community Resource Project WIC program in Sacramento. She's an IBCLC, a lactation consultant, but she also has a background in marketing and communications, which is probably one reason she's been one of the successful, or one of the partners that's helped make milk drives in the Sacramento area so successful. So Jennifer, we welcome you and look forward to what you have to share today. Take it away.
Thank you so much, Margaret, and thank you, Pauline. There's going to be some overlap in some of our slides, which is actually good because it just shows how well we work together. So before I get started, I just wanted to preface some of the next few slides I'll be sharing and just talk about the collaboration and the partnerships that really went into making this first event successful for us. I'm presenting some of the information today on behalf of the president of the Breastfeeding Coalition of Sacramento, which is Heather Conway. So I'll be sharing information about how we work together as a team to help make this happen, along with Pauline and some others. sorry about that. There was a small delay there. So the initial idea to host a milk drive in Sacramento came about from several conversations that had been going on at some of our community events and conferences that we have here in California. And then our coalition president received one of these urgent calls to action, or calls for breast milk. There's one here that's from earlier this month that you can see, and it inspired Heather, our president, to explore some ways that we could help increase milk donations out of the Sacramento area. So she connected with Pauline and talked about potentially putting on an event to just generate awareness, potentially pre-screen moms. That's sort of the initial idea that we had. And we decided to leverage the holiday season because it was coming up, and the whole idea about encompassing the spirit of giving in the holiday season. So we came up with some goals for the event. The first was to increase support for breastfeeding and the use of human milk as a preferred alternative to formula. And the other was to just generate awareness about breast milk donation and support our milk bank. So you'll notice that the event that we set up was not designed as a format to collect milk initially. We just wanted to generate some awareness about milk donation. So with just about 2 months to go before the holidays, our Breastfeeding Coalition teamed up with WIC. It's a natural collaborative effort. With the WIC program, as many of you know, we have women coming in to our clinics regularly to meet with our staff and discuss goals for breastfeeding. In addition, CRP WIC, our agency alone, has more than 40 educated breastfeeding staff between our peer counselors. We have certified lactation educators and board-certified lactation consultants. So they were able to help encourage mothers to explore milk donation as a possible option if they had oversupply, had more milk than they needed. And in addition, we knew of some of our own WIC mothers whose babies benefited from breast milk donation because they were born prematurely. So those moms could help spread the word in their community as well. So our president, Heather Conway, scheduled a meeting with a local assembly member, Dr. Richard Pan. He is a pediatrician, and he also happens to be the chair of the California Assembly Health Committee. And after his staff learned about our coalition's mission and our upcoming event, they signed on to help support us and arranged for Dr. Pan to be on site the day of the event for any press that was going to show up. And so then we needed a space. As Pauline said, a space is very important. So we reached out to our local health care organizations in the community. We have 7 hospitals in Sacramento County. So through some of our connections, we were able to secure support from Sutter Memorial Hospital. And they allowed us to host the event for free in their new pediatric medical building. And since they had just achieved baby-friendly designation earlier that year in the spring of 2012, the hospital was motivated to continue to demonstrate their support for breastfeeding in the community. And they were also really interested in gathering some media coverage about this support. So they loaned us their PR officer, their PR department, to help generate some coverage for the event. So we started off by putting together just a colorful flyer. The flyer I'm showing you on the screen now is from our event from 2013. We used a similar flyer for the 2012 event as well. But we wanted something that talked about the importance of milk donation, leveraged the holidays, something that could be attractive and eye-catching. And we made sure that this was posted in all of the hospital NICUs. We made sure it was posted in all of our WIC clinics. So there's about 12 sites all throughout Sacramento between 2 WIC agencies. And then in all of the different cubies, the cubicles that the staff members at the WIC agencies had, they had these posted as well. And in addition, my role as a regional breastfeeding liaison for the WIC program, I was able to help circulate these flyers to many of the pediatric and OB offices in our area and speak directly with physicians about the importance of milk donation for premature infants. And many of these offices, they're always looking for holiday decorations, and they have this cute, colorful flyer, so they went ahead and posted it in their offices to show their support. And we also posted flyers and messages on our Facebook page. So this is just a sampling of what it might look like to post on the Facebook page. And they were able to click on the event and learn more about it. We did this to multiple Facebook pages. So we had our local La Leche League groups posted on their group sites and Facebook pages. There's a local mom center called Herself Moms in Sacramento, and they posted it there to a network of over 300 mothers. Sacramento Bee posted it on their Moms Club. Then we had the hospitals distributing flyers at support group meetings and outpatient breastfeeding meetings. And we also provided the Q&A. So we modified, just to make it a little bit shorter, the Mother's Milk Bank Q&A, because there's a lot of families and mothers that were not familiar with milk donation. So we made sure that the physicians and the hospitals had information that they could distribute to moms who might have questions about the process, similar to the questions Lori asked, you know, how do we ship the milk? What's done once it gets there? How are these moms screened? And in the meantime, a few of our members were working behind the scenes and trying to secure donations so that we could put together what we called mommy swag bags. And those are those red bags you see up against the wall in the back. And we also were able to secure some raffle prizes from these same donors and get some donations to put towards food and treats and snacks for little hands that needed something to hold. And I talked a little bit earlier about some of the major players on the community side. So I talked about all of the different partners involved in the process in terms of planning. I just wanted to show you some of the donors and sponsors that we had for both of the events we've had in the last 2 years. And they were donating items like free 60-minute massage, gift cards. We even had a Hygia personal use pump, postpartum yoga classes for moms to bring their babies to, family photography packages and gift cards, and hands-free pumping bras if they were still doing a lot of pumping. So there was a lot of really great prizes that we were able to get the moms in. So then we set up and we waited. And this was the hardest part because our first year we didn't know how many moms were actually going to show up. So this is myself and another one of our breastfeeding liaisons dressed with our ELF hats on, waiting to help. And what we later learned after the first event was that it was important to have a way to track the interest of the moms just so that you could get an idea about a head count. So we started coming up with an idea about having them RSVP through our Facebook page if they were going to be attending the event. So at first we were a little nervous, but then the moms started coming in. And first they started working directly with Pauline and her staff, and a lot of pre-screening moms came to get screened before they donated milk. And then we finally had our first donor. And after Yi, this is Yi White, after Yi came, they kept coming, dragging coolers full of frozen breast milk. And every time one of those mommies would walk through that door, all of us would cheer, no matter if they had paperwork in their hand or they were dragging a cooler. We were so excited to see them. And then Pauline and her staff really got to work. They were estimating and counting bags, collecting paperwork, and transferring milk into the larger coolers to take back to the bank. And we got to get busy too. There were lots of babies, lots and lots of babies to hold while mommies were working on paperwork and chatting. And we even put Assembly member Pan to work. And as a pediatrician in Sacramento for many years, he's a natural with moms and babies, so he got involved as well. And what we started to see happen, which we weren't expecting, was this incredible bonding that was taking place between some of these NICU mommies and the babies who had graduated that were seeing their lactation consultant for the first time again after several months. And then we were hearing some of these amazing stories. Amazing stories about the miracle of breast milk. Stories from moms whose babies were born prematurely, who were struggling in the NICU, and while their mommies desperately pumped to provide the medicine they needed. Times when it just wasn't enough, when they had to rely on donor milk and help get their baby through those times. Those same mommies brought their healthy, happy, thriving babies and showed them off and gave back any milk that they could to another mommy so that they could do the same. And that was incredibly inspiring. That was the best part. So the results, just a quick recap. This is our first event. We had over 25 moms screened or who donated milk that first year. And the day of the event, we had about 2,500 ounces collected in all those coolers. And another 2,000 ounces or so came in after the event in the months following. We also had multiple large donors that donated over 400 ounces, 400 or more. Some of those were WIC moms. And as Pauline mentioned, media coverage. There was extensive media coverage. All of the local television stations had come in to conduct interviews. We had a newspaper article run a 2-page spread the week before the event to help promote it. And that's some of that milk that came in. And this is some of that media coverage. So you can see this is a 2-page spread that took place the day after the event in the Sacramento Bee. I also included some links down here, and I'm going to just show them to you. We can't run audio, unfortunately, but just to give you an idea about the types of media coverage that we were able to secure at the event. So this is one of our local affiliates, an NBC station, Channel 3, that ran about a 1.5-minute long interview with a mom who donated 6 gallons of breast milk. She's actually a WIC mommy. And then we had coverage in online on CBS.com as well. So there's an article there. Unique donation drive in Sacramento. Hold on as I switch back over to here.
Jen, just go up to slideshow on the top bar, and then from current slide or whatever it is.
Got it. Thank you.
Mm-hmm.
So, and then some of the long-term benefits that I wanted to talk about were that the event itself was, it kind of blew us away, but what happened after the fact was that the milk continued to come in. We heard from Pauline that, you know, all the moms that were screened that didn't bring coolers full of milk that day, those moms, once they were cleared, they were able to donate. So it caused this long-term, this really positive long-term effect on milk donations in Sacramento and increased the number that were coming out of our area. We also had multiple counties outside that heard about it that started exploring milk drives in the future, and since then there's been several that have taken place in California and Oregon. And one of our goals that positioned the Breastfeeding Coalition and WIC as partners in breastfeeding and milk donation, and increased our following on our Facebook page as well. And last but not least, we had one hospital NICU that we really wanted to motivate to start using human milk. And sometimes the coverage that these events generate, that other facilities get from these types of events, is all that you need to sort of push the envelope and get those decisions made at whatever level they need to make. So overall, it was an amazing outcome. We had a great time, and our coalition decided to make it an annual event, and so we look forward to it every year. We've 2 years in a row now, and we've got our next one coming up this December. So just wanted to take some time now for questions.
That was fabulous, Jennifer, and actually quite moving, we found, just to see what went on and how it just really raised awareness, but also really created some bonds and some new partnerships. So we're so glad you shared about that. We do have quite a few questions, some of which have been answered, but I think it bears repeating. For example, if the milk is essentially sterile, does that destroy the microbiome in the milk or other nutrients? I think the answer is no, but Pauline, if you want to answer that, or Jennifer, and just review that. Also, maybe at the same time, talk about what is done with the donated milk that does meet standards. I think they probably mean does not meet standards.
Right. So can you hear me?
Yes.
Okay. So the milk, yes, in California, we actually have tissue bank licensing requirements, and they pretty much follow Humana guidelines, which is, when we process the milk, the issue is that milk is used for very vulnerable and very fragile infants. So we don't want to have a situation where there is a disease transmission or a bacteria infection transmitted to these small infants who cannot tolerate it. So what's left after the heating and freezing? Well, a lot, basically. The nutritional value is there. And yes, we lose some of the components, but in actuality, to tell you very honestly, in 40 years, we have had infants whose sole diet, and I don't particularly like this because it's hundreds and thousands of ounces of milk, but we have had infants whose sole diet was donor milk, and in fact they do beautifully well. Even with the lessened amount of bacteria in the milk at the time, they did well with the milk. So the composition is perfectly fine for nutrition of these infants. And the immunity is still there, the growth hormones are still there. And for the most part, it's interesting that there are thousands and thousands of components to human milk that have really intricate ways and mechanisms where they interact with each other. And surprisingly, we know that milk can be frozen for a very long, extended time and still be very viable for the infant. So it's the best that we can do right now with the equipment that we have and the knowledge and the research that we have. And of course, Humana, as an organization, we're always looking at new alternatives and ways to make it safer, if there's any way of making it safer, and obviously to make it, as better than, more effective, if you will, than what we've got now.
Great, thanks, Pauline. We have several questions regarding screening and donation. I'll try to summarize them or mention a few. Can anyone bring milk to a donor drive, or do they have to go through pre-screening at the drive and donate milk afterward? Can somebody donate milk at a drive who hasn't been fully screened yet? Those kinds of questions.
Yeah, I think, Jennifer, we both can say we had all kinds of moms showing up, right, Jennifer? They were in various levels of the screening procedure. And because we had the coolers available, if a mom who has never actually called us or gone through the verbal screening and the paperwork, but just came in with her milk, we took the milk and tried to complete the initial screening right there at the event in a quiet corner and get her started on the screening. And in fact, we wanted the milk in our freezer so we can be assured that milk will not be tainted or thaw out before it's usable. So it actually is a little bit different than if a mom called us and said that I have milk, can I get through the screen? It's a little bit different, but what we found with this event, that these moms who brought their milk in and we had nothing, they were willing to sign the consent forms and give us the information on paper. We did the screening there. They were given information on where was the closest laboratory to get their blood drawn, and in Sacramento, actually, the lab is just right around the corner. So we could actually provide them all that information, screen them immediately, and they can walk around the corner and get their blood drawn. And we will store the milk until we get the results, and then use the milk once we get the results. So it's okay. I mean, the point is on these milk drives is that we get the word out that here's an opportunity for moms to donate and help other babies.
Great. I think that answers several questions here. One good question is there a cost for moms to receive donor milk? Basically, for cost for babies to receive donor milk.
Well, I think just the same as all Humana banks, there is a service fee. I mean, it costs us money, obviously, to ship the milk or transport the milk, and to heat treat the milk is all basically manual labor. We don't have a huge machine that we throw all the milk in a vat and it kind of spits it out like a dairy. It's all manually done, and we do need to, pay our people to do the work. And so there is a service charge, a service fee for the processing of that milk, and it varies depending on where you are in the U.S. and which milk bank nonprofit milk bank you get it from. That service fee in California, by the way, if it's for an outpatient infant that meets criteria of a mom being away from the baby or preterm infant, actually the Medi-Cal program will cover the cost for it. Some of the other third-party insurers, we work on a case-by-case basis to get coverage. But there is that service fee, which, of course, if someone's looking at it in comparison to the cost of formula, there is no comparison. It is much more. But we have to understand that where we get the milk are mothers, and it's it's time-consuming. It's a lot of work just to find the mothers, and so that milk is considered in California a human tissue, the same as blood or eye tissue or skin tissue. It's not like formula, and we certainly make that distinction when they call.
Great, thank you. Here's a question for Jennifer, perhaps. How important of a motivator at the milk drive were the goodies and raffle prizes?
So for the moms,
Mm-hmm.
I would say not very. They didn't know. Many of them didn't know because we were still, because the first year we had such little turnaround time. We weren't really sure what we were going to have. So I think it's a nice to have. And I think it's a way to get your other community, members of the community, involved in a good cause. So I think there's a kind of a win-win there, but I don't think it was a driving factor to these moms. These moms really wanted to be part of something bigger.
That's a good point, yeah. Another question, is there funding for pumps and blood work for low-income moms? This was a barrier that kept me from donating when my children were little.
Sure. So the blood test is free of charge, and the milk bank pays for that. So that part is free to the donor. Now, breast pumps are not necessarily something that the nonprofit milk bank in California, us in San Jose, we do not provide breast pumps for the moms. What we find, the majority of our moms that are donors have either a breast pump already because they're back at work, and a good number of our mommies are working moms, so they have a pump. We've had situations in Santa Clara County where we work, very well with the WIC office in Santa Clara, and if it looks like this mom has a copious amounts of milk, a member of WIC, and she may be going back to work, of course, every now and then they'll get a pump through the WIC office. And we also, our San Jose Milk Bank, we also have a program for Medi-Cal breast pump distribution. So if a mom who is lactating who wants a pump and is enrolled in the Medi-Cal program, she can get a electrical double-sided kit pump through the Medi-Cal program, and we could help her get that pump as well. So the Mother's Milk Bank, we don't give pumps out directly to moms just for the purpose of donating milk at this time.
Right, that's a good point about Medi-Cal. Should be able to provide them if they're eligible for Medi-Cal, but also anybody who's in the health exchange through the Affordable Care Act now should be eligible for services such as breast pump through their health plan. So that's a relatively new thing, and we should all be advocating for that. Jen, I think you said that somebody was asking, what's your timeline for the project from start to day of the event? It sounded like about 2 months. Is that correct?
So for the first one, it was 2 months just because we were trying to get it, leverage the holidays and they were upon us. And so this past year we started a little earlier, about 3 months out, and we hit some of the same contacts that we had in the past, and they were really happy to participate again. So I think 2 to 3 months is ideal.
I could say something on that as well, is that this year, because of Jennifer's outstanding work, we have gotten calls to run a milk drive on the first week of World Breastfeeding Week, which is the first week in August. And so we have multiple sites that we're going to be doing milk drives, almost to the point where all my staff people are going to be farmed out to different parts of California on the first Saturday of the World Breastfeeding Week. But so this is an event, as Jennifer said. We could do it at any time of the year, make it an event for Mother's Day or Valentine's Day or whatever, or any event. I mean, it doesn't necessarily have to be all during the first Saturday of the World Breastfeeding Week. To remind people that August is World Breastfeeding, or it's Breastfeeding Month in the U.S., as the USBC designates August for that event. But I think it's I don't want anybody to think that they're doing milk drives every week. It's kind of like a once a year kind of event, and that we really, really would appreciate it. And we want to have the milk bank staff involved, that somebody from the milk bank be there to answer the questions. So be that it may, we love doing the milk drives the first week of August, but there are other days of the year that we can do this as well.
Great, Pauline. Here's a question that also leads into another one, which is, how does a mom in Southern California begin the process of becoming a donor? Does she contact your agency and go from there? And our related question is there another milk bank closer to her, or also in the western U.S.?
Actually, in the western U.S., we have the closest milk bank to us is in Portland, Oregon. Our milk bank in San Jose covers the whole state of California right now as a nonprofit milk bank, the only Hispanic milk bank that does what we do. So the donor in Southern Cal can call our toll-free number and immediately get screened Monday through Friday from 8 to 5. And it's a 5-minute phone call. We do have a Spanish interpreter as well, full-time with us. So even our Spanish-speaking mommies can call in and get screened and get all the information and how to donate milk and how we're going to ship the cooler to them and the blood testing and so forth. So it's easy. It's really easy. Just call our toll-free number, and Monday through Friday from 8 to 5, and we can certainly help any mom to get started.
Great. Thanks, Pauline. We have time for just one or two more questions. One is, have you had any issues with Prolacta and other for-profit companies competing with your organization in ways such as swaying hospitals away from your bank? What was your best source of funding to recommend for us as a developing milk bank?
Well, you know, I think my position has always been, and this is for, I think you're talking about a Humana bank that's developing, I'm hoping. But my position is, you know, there's plenty of need. As I said before, there's 70% of the NICUs out there that aren't even using donor milk. So there's plenty of need for milk. And at the same time, you know, things like milk drives and our other activities that we do. In San Jose, we had a flash mom event, you know, and that brought a lot of interest to our milk bank as well. And I think that, you know, as long as we find the donors, we'll be fine. And Prolactis Services does a service that currently Humana does not. We provide donor milk, but certainly we don't provide the fortifier that they, you know, that they produce, manufacturer, and we don't do that. So it's a different product. I think that, you know, yes, we're looking for we're all looking for those donors, but certainly one can't use their fortifier unless you have mom's own milk or donor milk. And so it's really important to us and really to the moms who have those babies that are really in desperate need and are very vulnerable, that we need to make sure that we find the milk for all those babies that need it.
That's great, Pauline. Thanks for ending on that note, and hopefully you have all gotten some information and inspiration with today's webinar. We need to wrap up now. I want to thank Pauline and Jennifer both for participating and sharing their experience and expertise. You can find both of them through their contact information. Jennifer's is still showing on the screen here, as well as go to the mothersmilkbank.org. Is that your website address, Pauline?
Our address is mothersmilk.org, www.mothersmilk.org, and our Facebook, if you want to find us on Facebook, we're Facebook at freshestmilk.com. So Facebook/freshestmilk.
Very good.
And you can find us there as well.
Great. And just a reminder that we've recorded this webinar and it will be posted on our website in the next couple days, and as well as their PowerPoint slides that you can access with their contact information. So we hope you've enjoyed this webinar, and we'll check out future webinars that CWA provides. Want to add anything, Lori?
And we hope that WIC agencies across the country will consider teaming up with the nearest milk bank to increase donations from WIC moms and for WIC moms through their own regional and state networks. As many of you know, WIC has finally has more breastfeeding moms than formula feeding moms, so we are a significant source of mother's milk donations, which I'm very happy to report. Stay tuned for some more exciting webinars coming up this summer, and thanks to all of you for listening. Have a great summer.
Thanks for participating, for your questions. We'll see you at the next webinar.
Thank you.